For years, pediatric cardiac surgeries were done once a year locally with the help of international heart surgeons who would visit and carry out the procedures in collaboration with local health personnel at the Georgetown Public Hospital. However, the heart surgery program was halted in 2018, and since then, the Ministry of Health has only been sending emergency cases abroad for the surgical procedures to be conducted. At the moment, there's a significant backlog of children diagnosed with heart disease that are being made to wait to access the medical life-saving interventions.
Over the last 2 years or so, we were only able to send maybe about 5 children. One went to the United States, 4 went to Cuba. Of the 4 that went to Cuba, I think one of the patients, while they had a very successful surgery, one of them died. So that has been challenging both for the parents, obviously, and all of us.
This is against the backdrop of the exorbitant cost of such complex surgeries overseas, which only allows Guyana to send a limited number of children to access the much-needed medical care. However, help is on the horizon for these little patients, as on Friday, Minister of Health Dr. Frank Anthony announced that his ministry will begin to put the necessary measures in place to resuscitate the annual medical visits from overseas heart specialists, which should result in a significant decrease of backlogs.
And they have agreed to come back to Guyana starting this year. They would have to make an appraisal of the types of equipment that we currently have at the Georgetown Public Hospital. We'll have to buy a lot of the equipment and bring it in. And then by the end of the year, we'll be able to bring in a specialist team to be able to do the cardiac surgery. We're expecting that this year, more closer to the end of the year, that we'll be able to do at least 20 cases.
Meanwhile, on the issue of the utilization of the Sinopharm COVID-19 vaccines, which arrived on Tuesday, Dr. Anthony said that from this weekend, health staff will begin to benefit.
We have, because it's a new vaccine, we've had some experience with the AstraZeneca one, and we know how to use that. This one, we have all the information, but out of an abundance of caution, we went back and we trained our healthcare workers how to administer this particular vaccine. And we had to develop some information, booklets, that when someone come to get the vaccine, that they are also receiving information booklet.
Temika Rodney reporting for the HGP Nightly News.